There we go.
Welcome back to a second chance. My name is Philip Jones.
Hi, everybody. I'm Tafaro Cook, two-time kidney transplant
Yeah, I
recipient
don't know.
and founder of Kidney Care Coaches, where we coach stage 3 to stage 5 kidney disease patients.
Good to have you back with us, Mr. Cook. We have a very, very special show for you guys today. Awesome story of a fighter and his parents, loving parents, and we want you to just kind of understand what they go through, on a daily basis. So, Mr. and Mrs. Smith, you want to introduce yourselves?
Are you able to hear us? It keeps going in and out.
Yeah, we can
We
hear
can hear
you.
you.
Okay.
Okay.
So he wants you to introduce yourself.
Yeah, I got it. So hello out there. My name is Tarik Smith. Uh, 49 years old, parent of four kids total. And I think our topic for today is our youngest kid, who is our exceptional child, Colson Kai Akello Smith. And he has recently turned 8.
Yes.
Dr. Smith.
Are you able to hear us?
Yes,
So sorry.
we can hear you.
Man, so bad.
Uh oh. We don't see you yet.
All right, well, while that's going through that, I'll do a small introduction. For Dr. Marini Smith is actually my former education professor who kind of got me going into becoming a teacher at Southwest College. She's now a professor at West LA College, and they're back. She
Yep.
hasn't finished. Go ahead, continue. You can finish. Go ahead.
Uh oh. Oh
Man.
no. So sorry.
Can we keep our camera off? And maybe that will help with the bandwidth.
No, it's not very helpful to be in an interview
I
with
don't,
your
I don't,
camera.
I don't have a
Can you
problem with
hear?
that.
Yeah, and we can hear
We
you.
do
We can
Okay,
still
well,
recording,
hear
so
you fine.
as long as we can hear you, yeah.
okay,
Yeah,
let's try that. Let me try it and see. Okay.
we can hear
So
you.
where we don't see Tafaro, we see you, Philip.
Then we don't really need to see them, so maybe we can turn their cameras off or not.
Our apologies to everyone who's watching. This
That's
is
no
the world we
problem.
live in. Sometimes technology is reliable and sometimes it's not.
Yeah, you wouldn't believe the issues I've had to deal with on Sunday. So,
Exactly. Okay. Maybe this will be better a little bit. Are you able to hear me okay?
Yes.
yes.
Okay.
Hmm.
I can't hear him at all, Phil.
Yeah, I can't either. All right. Well, we'll keep going anyways. Sometimes you got to improvise. Um.
Yeah, go ahead and tell about her
So.
story, huh?
So yeah. She's now a professor at West LA College. She's actually a works and teaches at a number of other colleges as well. She's now in, I think, early childhood development, if I'm not mistaken, at West LA. She was originally, like I said, an education teacher at Southwest. Um, and okay, here we go. Let's see, hopefully this works.
We're back. We got kicked out. Sorry.
No problem, no problem. So, Dr.
I'll try
Smith, you
turning
want
off our
to
camera.
introduce yourself? Can you hear us? Can you hear us?
I can hear you.
I'm so sorry.
I can hear them.
We can hear her. We can hear her.
Right. That's just how Spectrum's internet for some reason is, because it does the same thing on my end. Sometimes it'll go out like this, but you can still see me.
We don't hear you.
She can't hear us still, but we can hear her. But she can't hear us. So that might be a challenge right there.
Hold on one sec. I have a suggestion.
Can you kick him out again?
Yeah, I think so. Can you mute your microphone real quick?
Yeah, I will.
Give us 1 second. We're going to figure this out. Hold on. Give us 1 second, please.
Do you want to maybe type your questions for us into the chat? If you can hear us okay, because we don't hear you very well. Your voice goes in and out. So maybe you can type the questions for us into the chat, and then we can just speak to the questions and talk about our story if you would like. So sorry about the technical issues of all days. We have no internet.
Can you hear me? Can you hear me?
Not really. In and out. Okay. Okay, so we can go ahead and tell our story. Okay, perfect. So Tarik mentioned in our intro that we have a son named Colson that we call Coco, he just turned 8 on October 27th. And he has a rare X-linked genetic mutation called IQ-SEC2. He was diagnosed when he was about 3.5. So that was in March of 2017. And when we found out about his diagnosis, we were not given much information. We were told that it is very rare and that less than 100 people worldwide were diagnosed with this disorder. Of course, our main question was, what about his quality of life and life expectancy? And luckily, they explained that this disorder was not degenerative, but that it would be marked with severe seizures and global developmental delays, which he had. So going back a little, I have another son, Noah, who is about 22 months older than Coco. So, and being a child development instructor and having another child close in age, when Colson was born, everything seemed completely normal. We were very excited to welcome him into our family. And at about the time he was 3 months old, this is a time developmentally where infants are starting to show growth, like more head control, starting to reach and grab for things, eye gaze, eye contact. And we were noticing that Colson wasn't necessarily doing those things. He was still what I call very floppy, very newborny, like he still needed a lot of support to be held. And so at his 4-month baby well visit, I mentioned it to the pediatrician that we were a little concerned. And of course, it's a little early. So the pediatrician at the time said, well, do more tummy time. And tummy time is something that you do with newborns where you put them face down so that they can start developing their neck muscles. They can start to learn to push up. It's kind of the precursor to crawling, and it helps them developmentally. So that was our advice at that time. But then a couple of months later, when he went into his 6-month baby checkup, he was pretty much in the same place developmentally that he was a couple of months earlier. And those of you who have children know that each month you see lots of gains and lots of advances in a child's development in that first year. So when you don't see it in a few months, it is cause for concern. So
Did she go? Did they go back out still? Phil, you're muted.
Yeah, I think they lost the connection again.
Well, let's just give them a minute and see if they can come back. Do you think she's still talking, or I mean, that's
I don't know. That's what I was thinking as well.
Okay.
Mute your mic real quick.
Yep.
If you don't mind, give us 1 second. We'll be right back.
Hey, what is going on, world? Edward, Mr. Why Not Drake is here. Hope you all are having a fabulous day. I just got on here real quick just to ask you all to please consider supporting the Why Not Foundation annual Why Not Impact Lives holiday drive, where we go across the country delivering gift bags to pediatric transplant patients and families at various treatment facilities and hospitals. And this year, we'll be adding a little extra seasoning by treating families to dinner. We'll be giving them gift cards so they can go out and buy turkey, some ham, chicken, whatever they're into, and just bring their families together. Because, you know, we're all about connecting and bringing families together and brightening the lives of people. So I ask you all to please consider supporting us by visiting www.whynot.org, spelled YNOTT.org, to make a donation to our holiday drive session. And also, I ask you all to follow us on all social media platforms at Why Not Connect, spelled YNOTTCONNECT. And just like my hat say, just believe, and I'm trusting and believing that you all will support our efforts this year and help us impact and brighten the lives of many people. Why not have a great day, and God bless. Take care.
So sorry. Can you hear us? Okay.
Yeah, we can hear you.
Okay. It sounds good right now. So I'm going to just continue and pick up where we were. Is that okay?
Yeah.
So at 6 months, when the pediatrician verified that there was a problem, he referred Colson to pediatric OT and PT to have an assessment done. And when that assessment was done, they diagnosed him with hypotonia. And hypotonia means low muscle tone. And so low muscle tone could be connected to a variety of disorders. It could be just something that happens by itself. We did not know why he had hypotonia, but we started at 7 months with occupational therapy, physical therapy, and we were seeing some improvement. He was still very delayed, but we were seeing some improvement. When he was close to 1, he had an MRI done. He had a scan of the brain done because the geneticists, the pediatricians, they of course want to understand, well, why is this child who was born typical? You know, I was 38 years old when I had him. And so when a mother is 35 and over, they're considered of mature maternal age. And so there's certain tests that are done when you're pregnant to screen for abnormalities, and everything came out good. So we were very shocked and didn't understand what was going on. So we had the brain scan done. And I will say that the way that we were informed about it was not very supportive and very professional. I was given a phone call by a tech who just said, yeah, we're seeing some issues with the brain scan. His brain's not growing the way that it should. There's a lot of space. The ventricles, the spaces in the brain should be smaller. His ventricles are bigger. And it wasn't his neurologist who was giving me this report. The neurologist was out of the country. So I was getting this report from a tech who didn't really have any information to give me, no context, no like, this is what this means. This is what you can do. These are the next steps. So hearing this, of course, as a parent, I start Googling. You know, they always tell you don't go to Dr. Google, but I start Googling, like, what are the causes of enlarged ventricles? What are the causes of this? And so as I'm reading, the thing that came up was cerebral palsy. So I remember having a breakdown. I called my best friend and I'm like, he has cerebral palsy, you know, and as a parent, you know, we always say we want our children to be healthy. So I panicked and I thought, okay, this makes sense. It fit his description from what we could see physically. So in my mind, I'm like, okay, I can deal with it after the initial shock. this is probably what we're dealing with. But then when we saw the geneticist not too long after that, she said, well, he has some markers that would look like cerebral palsy, but then he has others. There are other markers that would not indicate that. So we're going to do some more genetic testing. So they did, they tested for specific disorders. So first, because genetic testing is very expensive. So they start, with what they think is going to, they're going to try to find the answer as quickly as possible. So first they started testing him for specific disorders like Fragile X syndrome, Prader-Willi syndrome. Those things came back negative. Then they want to do what's called a microarray. So that's another form of genetic testing where they're looking at a lot of his genes, and it came back inconclusive. So we're continuing with all of his therapies. And again, he's making progress. It's very small, but he is making forward progress. So while a typical baby might start crawling between 7 and 9 months, Colson started crawling right before his second birthday. While a typical baby maybe starts sitting up around 6 months, Colson started sitting up around 13 months. So he was making progress. It was just very, very delayed. So everything really, really started to, I don't know if you want to say fall apart, or everything started to really escalate. I remember it was Memorial Day weekend. Colson was 2.5 and took him out of his crib. He was on the changing table. I was changing his diaper, and then his face froze, and then his lips started turning blue. And I panicked. At first, I thought he was trying to have a bowel movement and was straining. So I was kind of looking at him like, are you okay? And then I picked him up and he just kind of went limp. And I, as a parent, you're panicking like, oh my gosh. And I had his brother who was about 2.5. No, he was 4.5 at the time. He was off from school that day. It was a holiday. And then I prepared to get Colson ready to take him to the emergency room because I thought maybe he seemed like he was unconscious, but he was asleep. So he froze, he went limp, and he was still breathing. Lips returned to normal color. I rushed him to the emergency. I called my husband. I called my mom. They met us at the hospital. And this whole time he was asleep and breathing. And so when we were in the waiting room, my mom said, I think it sounds like he had a seizure. And of course, he had never, to our knowledge, had a seizure before. The doctor examined him. I explained what happened, and he said, yeah, that sounds like a seizure. So they just basically told us to monitor him. When you have one seizure, it's not typically diagnosed as epilepsy. It's when you have more than one seizure with like a non-determined cause, then it becomes diagnosed as epilepsy. And so 2 weeks later, he was in his early intervention program. He had another seizure during circle time, fell asleep for about 2 hours, and then he proceeded to have 2 more that same day. They diagnosed him with epilepsy, and then he began taking epilepsy medication, which is, anyone who's suffered from epilepsy, that it is so difficult to determine what's the right combination of medication. There's so many different side effects of the medication. You might think you have them controlled, and then you have breakthrough seizures and you have to change the medication again, and it starts all over again, trying to figure out what medications do we take, what are the side effects. A lot of side effects make you very, very drowsy. And so that's very difficult to function if you're asleep all the time. There's some medications, like the first medication he was prescribed is Keppra. In kids, Keppra is a very popular one. And there's something literally called Keppra rage, where kids who are on Keppra have violent outbursts, and there's self-harm, and there's huge, emotional disturbances. Luckily, he didn't have that, but it did not control his seizures. I don't know if you want to take over because I'm doing a lot of the talking.
No, yeah, you're doing great. I do remember in the beginning, there was a time I had him with me solo too. He had a convulsive seizure. And that was extra scary. That wasn't like the ones that he had been having before. But But yeah, I think now it's probably best to talk about like his like first prolonged hospital stay, right? Like after
Mm-hmm.
so that was pretty scary. I mean, I feel like you're better with the medical terms and whatnot, but we had a medical stay because he had like what was like an extended seizure, and it didn't seem like he was coming out of it. Um, I mean, we were terrified, so we just ended up taking him to the hospital. I don't remember the name of the medicine that they were giving him to bring him back from those
Yeah.
seizures when we were in the hospital. You remember the name of that? It was like some
Yeah.
super strong drug, but anyway,
I
it
forgot what
like
it's called.
it was like a sedative.
Yeah.
And yeah, I think that was a moment where it just got really real. I mean, he was in the hospital for a good 2 weeks during that time. And again, we still didn't have like the actual diagnosis of the IQ SEC2 at that point. So there was a lot of mystery around it. There were tests that we were given for diseases that were terminal. So we were obviously really relieved when those things came back negative. Um, because there are a lot of degenerative diseases that he was presenting as a possibility of having some of those. So, that was a relief.
Yeah. It was Ativan, by the way.
Ativan was the drug that drug had him completely laid out. It was pretty scary. And they just kept like upping the dose or like increasing the frequency of it because he was still seizing even after.
They didn't know what was going on.
And they were
They were
completely
stumped.
clueless. They were doing the best they could with what they knew, which was not much. And again, all those different diagnoses that they were looking at as possibilities kept getting eliminated. But yeah, he ended up like feeling like a really different kid by the end of that hospitalization. Like what Marini described in terms of him like making progress, but definitely on his own time and having delays. I mean, I would take those days in a heartbeat compared to, what happened after he started really having the seizures. I was like, okay, we're doing it. He's doing it on his own time. You know what I mean? But he was still laughing and cheesing and like so much joy. He was just like
walking.
a really fun kid. Yeah, he was like cruising around. He had this thing where, like, if there was paper anywhere loose, and we're both teachers, if there was paper anywhere loose, it would be in his mouth. Yeah, that was a little bit of a scary, accurate depiction there, Marie. But yeah, no, he was getting it in his own way. You know what I mean? And so it was really heartbreaking to kind of see how much these seizures were like knocking him back. And then I'm not as good at timelines. But yeah, so I would say, yeah.
So that hospitalization was, so he started the seizure 2.5 years old. It was in May, Memorial Day. By August, he started having, we didn't know what it was called. Now we know that they're called drop seizures or atonic myoclonic jerks. So he would be crawling around on the floor or sitting, and all of a sudden, bam, his head would fall forward and he would hit his head on the floor, and then he would start crying. And I'm thinking, oh my gosh, did you slip? What happened? I remember taking him grocery shopping and having him in the shopping cart in the top part where you can put little kiddos. And then his head went forward, bam, and his head hit the handle. And I didn't know what to do. I didn't really know what was going on at that time. So I just picked him up and tried to comfort him. I left my groceries there and carried him out. Ultimately, we found out later when he was hospitalized in August that those are called drop seizures. And it's like your body loses control, jerks forward. And, he ended up having to wear a protective helmet for some time because we didn't want him to have head injury. So from May to August, decline. Everything that he had learned how to do, the pulling up to stand, the cruising, crawling, grabbing things, eating by mouth. So he was in the hospital in August, as Tarik said, for about 2 weeks. He went into the hospital eating food. I remember I have a video feeding him food by mouth. And a few days later, he would no longer take food by mouth. It was as though he no longer knew how. So we ended up having to make an appointment for him to have a surgical procedure to get a feeding tube put in so that he would get tube fed. And here we are, he's 8 and he still is tube fed. So during that hospital stay,
he also had the feeding tube through the nose for a while before that process was completed. That was crazy.
It was like 6 days in between when they discharged him and then they had to readmit him. So during that visit, I remember being around his bed. He kept seizing, and all of the doctors giving him Ativan. They didn't know what to do. And it was just crazy because he had more seizures during that time in the hospital than we had ever seen over those months before. So I guess in a way it was good it was happening in the hospital, but it was also freaky because we were not prepared. The doctors were not prepared. And I remember texting my friends, like, please pray for us, because we thought we were going to lose him. I'm just going to keep it real. We did not know what was happening. The doctors didn't seem to know. He had no history of seizures. We were not familiar with this at all, and it was just happening with full force, just taking over his little body.
And he was also in the hospital getting worse.
Yes, so it seemed like, and that's what I would tell people. I said we took one kid into the hospital, and we brought out a completely different kid. So during that hospitalization, he lost his abilities. The seizures got worse. They did a spinal tap. They did all of these tests to try to figure out what was going on with him. And then we had a geneticist come in. This is where things start to get really scary and problematic. So we had a geneticist come in, and he said, well, based on what we're seeing from, the types of seizures that he has, from the EEG readings and from the MRI scan, I believe he has this disorder called Batten disease, NCL5, I believe. And he just matter-of-factly told Tarik and me, this is what happens with kids who have this. They get a little bit better, and then they get a lot worse, and then he'll go blind, and then he won't live past the age 10. And he basically said that and then left the room. We're going to test him for this. We need your consent. This is what I think he has. So I remember Tarik and I went outside and we just lost it. We're just like, what's happening? What's going on with our child that we thought was completely healthy? And all of a sudden, all of these things are happening. And so that was a devastating blow. He was released from the hospital with the appointment to come back and get his feeding tube. And then, from there on, we just continued the fight. That was when we found out 2 weeks later, he did not have this disorder. He did not have Batten disease, but they did find out that he had this other disorder. They tested him. They did what's called WES, W-E-S, whole exome sequencing, which is when they try to analyze all of the genes. And I was learning from talking to the geneticist that there's still a lot that we don't know about genes. It's crazy that we have, however many hundreds of thousands of genes, and geneticists only know about a small percentage of them. Yeah. So we were told, we're going to do this test. It's going to take, hopefully you can hear me. Can you still hear me?
Yep. You hear you. Mm-hmm.
Okay.
Yep.
Okay.
Yep.
They said it's going to take, and there's only a 40% chance that we will come back with a result. You may not know. We may not find out what's going on.
Right.
We did get the results. We did find out about the disorder, the IQ-SEC2. And I remember I was called, I was teaching at a middle school, and I got the phone call while I was teaching in front of my students. Tarik was also at work teaching. So the way that we were informed was not good. And my mom and my sister were at the physical appointment, and we were told it was just a follow-up. I remember asking the receptionist, well, do they have the results? Do they have the results? And she's like, I don't see anything in my file that says the results are in. So we're like, okay, he's just going for a follow-up. So my mom and my sister had to be there to get these results. We had to be called while we're at work, and I'm in front of my students, and I got emotional because I'm hearing Well, he has this thing. We don't know much about it, but this is why. This is why he's the way that he is. So, luckily, we found a Facebook group. Lo and behold, there are other people in this world who have kids who suffer from this disorder. Now, I said it's X-linked, so the X chromosome, so it affects boys more profoundly than girls because boys only have one X chromosome. Girls at least have two, so if one X is malfunctioned, then the other X can kind of pick up the slack. But in a boy, you have it one X, and if that X is damaged, then the effects are more profound. But the strange thing is that there aren't many with his disorder in the US. A lot of them are Europe, Australia. So that I found that interesting that they're in different parts of the country, but mostly like in Europe. But there are some in the United States that we have been able to connect to, and there are definitely different levels of severity. I would say Colson is more on the severe side. Some of the kiddos can walk and talk. They all suffer, most of them all suffer from epilepsy, from seizures. All of them are globally developed. They have some developmental delays. So we're just working, we fight. I would say now our biggest fight, he's gone through different phases of his primary challenge. So the primary challenge at one point would be his epilepsy. Then for a couple of years, his primary issue was GI function. So he had a lot of problems with keeping his food down. He lost a lot of weight, so he was hospitalized for that. We couldn't figure out what's going on with his GI. And then his main issue, and still remains, his respiratory system. So everything, our bodies are amazing and resilient, but they're so connected, right? So because he has hypotonia, because he's not able to walk, he developed severe scoliosis. And your spine protects all of your vital organs.
Yeah.
So over time, his scoliosis curve went from about 30% to about 102%. So more than a 90-degree angle. So imagine if your body is curved more than 90 degrees and how that's going to compromise your liver, your lungs. So in 2019, he probably had more than 50 days of hospitalization over that year. It was the worst year. He had pneumonia. They called it upper respiratory failure. I was on a first name basis with the paramedic because we had called 911 so many times. So I knew I would say, "Hi, Jessica. We're seeing you again. Hate meeting you like this." He had to be intubated more than once. It was very, very scary. Very scary. On New Year's Eve of 2019, so New Year's Eve, we were ringing in the new year in the hospital. He was able to get scoliosis surgery at Children's Hospital. I still believe that surgery saved his life. Obviously, it was very scary because it's a major 5-6 hour surgery. His surgeon was amazing. So he has what's called magic growing rods. So they have this amazing technology where they put these rods in your spine, and every 3 to 4 months we go in, they have a magnet that attaches, you just hold it to the back, turn it on, and it stretches just a few millimeters. It lengthens the rods as he grows. Whereas years before, every time they needed to stretch the rods, they would have to go in and do it surgically. So they would have to go in, operate, and move the rods. And we know that Colson's little body and all of his respiratory issues, he would probably not be able to endure. So we're just so thankful that they have this technology. So he just got his spine lengthened last Friday. It was his 4th time. And they'll do that until he's about 10, until they feel like the maximum of the torso is grown to its capacity. And then they'll go in and do another surgery. It's called a spinal fusion. And that will be like the permanent rods for him. And then he also had to have double hip surgery, July of 2020. A lot of kiddos who are non-ambulatory, they often have hip problems because we don't think about it. Like when you're walking and you bear weight on your body, you are keeping your the joint in the socket, everything's in place. But if you're constantly in a seated position, Then there's room for dislocation, or they call it subluxation, which is like the precursor to dislocation. So we had to preventatively have the double hip surgery, which ironically, the recovery for the hip surgery has been even more challenging than the recovery for the spinal surgery. I don't know if Dad wants to talk about the IEP. The school and the IEP process is a whole nother animal. Don't get me started, because I get so mad when I think about everything we have to go through for him and his education. It's like the medical side, and then there's the academic side.
Let me chime in real quick.
Please.
The first thing I got to say is you parents are warriors. I'm just gonna keep it real, man.
Thank you.
Colson he's truly blessed to have both of you and the family also. I just want to say that that's big. My wife and I have a 10-year-old and a 20-year-old, man, and I feel what's going on, and I'm so thankful that they're healthy. Yes, but
Yeah.
wow. Going back to early age, when you said the assistant called you and told you and don't even know what's going on, and then to give you the information, that's really heartbreaking right there. Because I can only imagine as a parent, somebody's trying to tell you some information and they don't even know what's going on, and you're hanging, on each word you're saying because this is your kid, so you're trying to listen intently, and they don't even know what's going on. And you're trying to find out what's going on with your kids. I know that was challenge. That had to be super challenging with that. I just want to say,
Absolutely.
wow, man. So
Yeah.
let me ask you this though, with Coco now. So does he recognize you guys, like mind wise? Is he like alert? Does he recognize you guys and everything like that?
Yeah,
You wanna answer that?
definitely.
Okay.
I think to know Coco is to love him. Like anybody who works with him, like his nurses, people who have come into contact with him, they all really appreciate him and care for him and want to be his champion. And I think that's because even though he's not able to communicate in the traditional ways, like he's definitely still very alert and aware. Like when you come into the room or when you speak, like he turns actively to see who you are, and the way that he looks at you, it melts your heart. So even though he's not able to communicate in the traditional ways, he's definitely able to make his feelings, known, good or bad. Like if he's upset about something, he will definitely let you know. And I think, it's just our job to kind of like pay attention and be aware and know the ways that he's presenting. And I feel like, speaking for myself, I've definitely gotten better at that over time. Essentially, my wife and I could probably be like LVNs at this point, because of all of the work we put in with our son. So for me, it's been a real journey, like, going from like overwhelmed, feeling, incapable to like, to being in a position where I feel like I can more properly care for him. And also he's like a warrior, like whatever progress like he can make, whatever he can do, like he's gonna do that to the fullest, like when he's in physical therapy and he's really like under duress and in pain, like he doesn't really like quit, he like keeps going. So the ironic thing is like, yeah, it's definitely been painful or, challenging, even just emotionally, like constantly managing how you feel about the complexity of the situation is a lot, but kind of all of that pales, in comparison to like how much he's brought our family together and like how much he really like is kind of like the thing that we all rally around. So it's definitely, it's been a pretty amazing blessing in a lot of ways. And I just don't have time for like stuff that doesn't make sense now. It's really made things even more clear and like simple, you know what I mean? In terms of like doing things that matter for me and like leaving everything else alone.
Right. Because I was 18 when I first got diagnosed, and I was playing college ball, and that's when. And so, you as a youngster, when these things happen, feel to contest to this, life gets real serious. And it's just like my parents, I was the youngest of five, and even they even said that, life got real serious with that. But, I want to go back to, when you said you took him to the hospital as one kid and then he comes back as another. So some of the things you saw him doing when he was thriving, like Tarik said that he was moving around, he was, cruising, he was doing all these things and stuff. And then he goes to the hospital and he comes back as a different child. Can you explain a little bit of that? Because that's devastating.
Yeah, I mean, for me, like again, I'm just focusing on like how crazy the journey was as a parent. Like I think for me and Marini, it's just been a lot of like stages of grief and loss. I mean, I don't know if that's the exact right term, but like you definitely feel like a sense of like you're losing what you thought you had, you know what I
Right.
mean? And we were already
Yeah.
we were already adjusting to the fact that he had delays and all of that. I mean, I was rocking with it. I'm like, all right, we'll figure it out. You know, he's getting
Right.
speech therapy, he's getting OT, he's getting all of these things, and we're just gonna make sure that whatever his ceiling is, we do whatever we can to make sure that he gets to that ceiling. You know what I mean? And so I feel like in some ways that's been the through line. You know what I mean? But it was a lot. Like,
Can I give an example? Can I give an example?
yeah, go ahead.
So, two concrete examples that I can think of. Well, I have a lot of photos of him. Part of the reason why I wanted to have another child after Noah is because I wanted him to have a sibling to play with. So I have images, even though Colson was much more delayed. I have pictures of them sitting on the floor playing together, sitting on the floor playing with a toy or watching the iPad together. After Colson's regression, that was not something that he could do because he couldn't even sit up or hold up his head. There was this piano toy that we had one at my house and we had one at my mom's house. This like toy like that sits on the floor. It's like a mini piano, and we would like he loved this piano. He would crawl across the floor. He would go on the piano. He would start bang, bang, banging. I even have a picture of him. He was getting a 24-hour home EEG. So he's got all the bandages and electrodes and he's got this long trail of wires with the pack that's attached to monitor seizures. And he's dragging it across the floor to get to his piano. Tap, 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 tap. So precious. So we have the piano. Now he can't, he's got contractures now, like his hands don't even really open because of the muscle contractures, because of the delay, and he's not using them. So his hands are not even physically really able to press the piano, but I can't give it away. The piano is still in our garage because I'm like,
Right.
one day, like that was his toy. That was his favorite
Yeah.
thing. One day he'll be able to play that piano again.
Right.
So that's an example that I think of when I say the child that he was and then the child that he came out, And of course, there's so many wonderful things that we're learning in this journey about him and how he's able to show. But those are things that, I'm not going to lie and say that I don't miss that. And I want him to be able to enjoy life the way that he was able to before. So we just have to find new ways.
Right. Right. What have you learned from the Facebook group? Because I saw you guys have like, okay, Dag, this is a bright light into what's going on with the Facebook group. So
Yeah.
how have they been supportive, and what information have you learned?
That's a great question. Ironically, there are a couple of people in the group who have relatives who are like neuroscientists, like genetic scientists. There's one person in the group who her father's doing research on this particular disorder. So I would say the most recent advancement is through Boston Mass General. We're doing a fundraiser, and so because if you think about it, when there's a rare disease or a rare disorder, it's very hard to get funding behind it, right? Are they going to put money towards something where there's 100 people suffering, or are they going to put money towards something like cancer where there's millions of people suffering, right? So it's really hard to get financial support, like to get fundraising to do research for something. So one of the people in the group, they're doing these trials. I guess they're doing some sort of gene trials with some of the IQ-Sec2 kiddos. And so that's, for us, that's the most hope, that if we can have enough funds, we have some of the people who live closer who can send gene material to the hospital so that they can do the research. We're hoping that those kind of trial folks will give us enough information and maybe we can figure out ways to slow down some of the regression. But I think what the group has also brought is a little bit of hope, because, you know, you see all of these diverse kids and there's so much beauty. And somebody said they're all so attractive. Like, there must be something about this gene that makes all the kids so cute. They're all so adorable. But, you know, I think it gives us hope to see that there are some kids or adults in the group who are in their 40s. So that, again, gives us hope. You know, and again, this gene was only discovered in 2010. The gene itself, where the mutation occurred, they didn't even know that this gene existed in the body until 2010. So it's really new, right? So we don't have that much research to even go off of. So this group is really helpful, even though they're in different time zones. I know we did one Zoom a while back, and there was somebody in Australia, and she's like, it's 3 a.m. here, but I'm here because I want to meet the other families. So that's another benefit. But medically, we're just still in the trial process, and we're trying to raise money for more research.
Yeah, I could definitely say you guys are pioneering this right now. Especially you said 2010. This disease is a baby, so you guys are in the early stages of finding out what's going on. So you definitely got a testimony or a book or something like that to help lots of people. But how many African Americans, did they say anything like that?
That's a great question. I would have to look. I'm sure that somebody started to coach us, because somebody created a map where we could see visually on a map. They would pin every time somebody would respond, they would pin it. I don't know if they did an ethnic breakdown, but just based on what I see in the group, it's very, very few. It's mostly European, people of European descent. It seems as though there are a few Black
even
children.
America, right?
Yeah, I want to say that and I will say this too. So we joined the group. It's been about 3.5 years since we've been in the group. When we joined the group literally had about 100 people. Now I think it has about 400 people. Now that doesn't mean that it's each person equals one person with IQ, because like the two of us are in the group and maybe there's other family members in the group. But I can say that the more people are getting diagnosed, the more people are going to get diagnosed, because more people are going to be tested, and now the geneticists are going to know what to look for. So I'm hoping, I know it's a weird hope, but with more people comes more research and more understanding of the disorder.
Right. That's not a weird hope. That's as a collective, as more people learn, just like you said, with cancer, it's overwhelming. Phil and I talk about the organ donation thing. It's small compared to cancer. It's the giant of all these things. So we do need more research, and the more people that is engaged, it does help. Phil, go ahead, man. I want to steal the whole place. I can ask questions all day.
I told you, man. When you talk, I sit back and listen. No, but when you hear stories, like, we hear stories every week, and we sit here and we're in awe of everybody's story, because like I said earlier, everybody's story is different no matter what the outcome is. So I remember when I first learned about your son battling his illness, I was like, from then I was just like, okay, that dude's a trooper. I know what kind of people you are, what kind of people your family are, and I know the love that he's enduring from this situation, which is what keeps him fighting every day. I know this because that's what kept me fighting every day of my life, was my parents, my family always being there and things of that nature. So, but what really did it for me was the day I came to Children's Hospital.
Oh.
And I remember I walked in and Dr. Smith wasn't there yet. Tariq was the only person that was there, and we were just sitting there kind of talking, and he was asking questions and things like that. And I remember he went into a seizure while I was there.
Oh.
And
See,
I
I'm
can
gonna.
look at him. I could look
Yeah.
at him and tell that he's fighting his butt off right now. Because, it's for us, we can tell these things because we've been through it. Doesn't matter the age, or anything like that. But we know we can look at somebody and tell that they putting up a fight for their life, and at that time it didn't, and I know for you guys, it definitely felt like it just didn't feel like things were really getting better. It was like every time you look up, it was like, at the snap of a finger, something was happening. And you turn around and something else is happening. And I remember what honestly what put a smile on my face was your mom, because when she came in, it was just like we was in a hospital just to be sitting there chilling and having a conversation. And she's just one of the loveliest persons that I've ever
She
met.
always
Really,
asks about you. She always asks about you. Yes.
I hope she's doing well. I see when you posting pictures and everything like that, and it is great to see her doing well and still by you guys' side. And I know she'll never leave, so I'm not worried about that. But that young man fights every day. Even with Tafar having a kidney, he's still fighting. So it's easy for us to look and pinpoint it and say, okay, he's playing no games right now. And like I said, what gives him that fuel are those laughs that you guys make, those hugs that you give, Noah, your mom. That's what fuels a kid, because especially in a situation like that, when they don't really know that they're even fighting,
Yeah. Yep.
I mean, it took me honestly forever, and I don't have to go through nearly half the things that Coco has to go through. And even I was like, all right, I got kidney disease. All right, cool. And it's like got to the point where I was like, 12 and 13. And I remember, my Dr. Moore saying, you're going to need a transplant. You're going to need a transplant. I'm like, why does it feel like my life is about to end when you say this? And it
Wow.
was for me, because I actually went through what you were talking about not knowing certain things about an illness. I felt like how you guys feel with not like it feels like you're the only person in this circle, because forever from the age of 4 to the age of 17 when I got my transplant, it felt like it was just me, because I knew nobody that had kidney disease, even going to a doctor, because I was going to a pediatric nephrologist. And that's not to say that everybody is dealing with kidney disease. It might just be going to go see a nephrologist or, whatever the case may be. So it wasn't like I was like, walking into the waiting room like, hey, you got kidney disease too, and conversating and picking people's brains and stuff like that. It's hard when you don't know, because what you don't know, you don't know. It's not like you can say, oh, I don't know, I'm going to go with option A over here. How are you going to pick an answer you don't know?
Exactly.
So when you said that nurse called, and I'm like, I would not have pushed a button on the phone until I knew something other than what is in this chart. I need to know some information to give these parents, especially when it's something as young as the illness that he's dealing with, when there's no information to be given like that. I need to give something before I make this phone call. If you want me to do it, you have to give me something, because there's to be no reason why parents go to find something out about their kid and don't have an answer when they leave. that is something that needs to be mandatory, no matter who you have say it. If you're the MD, you're the physician's assistant, nurse from around the corner, I don't care. There needs to be some information given. It's not like you're talking to 18-year-old Coco. That's a different story because he's an adult. He can understand, he can put all this stuff together and go. But you were talking to parents that don't know nothing about something major that you just gave them some a diagnosis of. So yeah, I'm gonna let that go before I get upset around here. So
oh yeah.
I have one more question. How's Noah doing? How's the little brother Noah doing? Is he a good little brother?
You can speak to that.
Yeah, I'll go for that. Noah's awesome. I also have two older children from a previous marriage, and I feel like all of the kids, we definitely circle the wagons around Coco, and he really brings us together. But Noah's doing good. I think we could probably do with more conversations around how he's feeling about his brother. But he seems to really take ownership over, caring for his little brother. He actually has a lot of skills around his care as well. We definitely try not to parentify him, but he's willing and able when Coco needs suction and, helping with diaper changes and stuff, even, which is pretty impressive. So yeah, he's a really caring, sweet, super intelligent kid. And not to change the subject, but Philip, I just wanted to say again how much I appreciated when you came in and visited. I know we were
multiple times.
Yeah, I'm thinking about that specific one that you mentioned. And we've always been really invested in how your own struggle with your health has been going, and you look really good right now, man. It's good to see you doing well, and I wish you continued health, my brother.
I appreciate that. That part of that does have you guys to thank for that, because if I wouldn't have walked in education class, no telling what I'd be doing right now. And because I'm not gonna lie to you, when I got back in school, I was lost. And I remember sitting here, and what was crazy is that I didn't register for that class until the weekend before. And I remember sitting here and I'm like, I want to take class, but I don't know what I'm doing. I was easing my way back in school. Before I got sick again, I was, criminal justice, pre-law, and all this stuff, because I had plans, like everybody has plans, right? And I had a path that I was going to take to get to where I was going until everything happened. So, I'm on dialysis. I can see things starting to get better, and I can get to school and do things. And I was like, and I remember sitting here and I'm like, what do I want to do? So the first thing that came to my mind was, coaching. So I said, well, what do I need to do to get here? And I remember when I was in high school, our offensive coordinator got hired to work at our school. Our head coach was a teacher at our school. Our running back coach and our junior varsity head coach were teachers at our school. And I said, they want coaches that could be on campus to control their team. I said, well, I know what I'm going to school for. And I got in your class. I remember do you remember who I brought to class the next day?
Was it Darren or was it
Darren I met Darren in your class.
Okay.
Do you remember John Mayfield?
Yes.
That's absolutely who I brought to class the next day.
Oh, wow.
So
to add to class. Yeah, he was another amazing, he's gone to do big things.
Yeah, he went and got his degree from LMU after he left from Southwest, and he's doing this thing. So
yes, we were a strong group. You guys made me look good. It was a powerful group of young brothers who were
it was a powerful but kind of stupid group because and I'm gonna tell you why. And anybody who had that class that would hear this story would know I'm telling the truth. Do you remember the last she gave us a final at the end of the semester, right? And I remember we came in class, she said, look, she said, go ahead and work together, use your notes and all this stuff, and and get. So basically what she did was hand us an A. Do you think any of us got an A? No. I swear to you, when I got that test back, I said, how is this possible for us to be sitting in a kumbaya circle and we didn't pass this test? I was, it was then when I realized that certain things have to be done, number one, with work. Number two, on your own. You can't always rely on people. Cook. If you say no, I know you probably be lying to me. But you've been in class and you was like, man, I feel like studying for that test. We had a game on Friday, and you was like, hey, what's B? What's and you like, and then you get it back. You was like, bro, that was wrong. Like, I'm like, I was like, never again. I should have learned my lesson before.
That is too much.
I'm going to tell on myself because this is funny and it's stupid. And the reason why I'm telling this is because if any younger people see this, I just kind of want them to understand the importance of doing work on your own. I don't know if you were there when this person was there. Do you remember Coach Garnett?
Ooh, I don't. At Southwest? No, yeah. I don't.
So Coach Garnett was he was from Louisiana, but he was one of the most, well-respected professors around campus. Everybody knew him. He was cool. He was always cracking jokes and things like that, right? But he was also professional in the classroom. So, but he also used to bring his personal life as he was teaching. So I remember we took a test in this class. And I should have known this was a red flag from the beginning because nobody ever does this. And I remember somebody came and was like, hey, I got the answers right here for the test. Of course, knowing me, I did not study for this test because I got home late from track practice. So I was like, let me get that. So, let me go ahead and snatch that up out your hand real quick. And we all sitting in class, we copied all the answers down and stuff. Here's the thing. The answers weren't wrong.
Okay.
The order of the answers.
Oh, no.
So, like every smart professor does, it's the same questions, different order. Right. And not even the rearranging of the answers, but just the questions. So me knowing Southwest, it was a Scantron test. And I got this Scantron back and I just sat there and I just stared at it and I was like,
all the red lines.
Right. Right. I'm like, and I'm looking on the front and the back and I was like,
Yep.
Not gonna let nobody see this. And I just I just threw it in the trash can. I was like, yeah, well, that's how that goes. So don't cheat. Just do the work.
That's it. Do the work.
Do the work.
Ask for help. Don't wait until the night before.
When you run the Scantron through the machine to grade it, it sounds like popcorn.
Right.
That's when you know you're not getting a good grade.
Exactly.
Right. So definitely have you guys to thank for the confidence and always being there because you guys been there from day one. From day one I walked into your class, the day one I met you. Do you remember the day I met you? Y'all gonna be like, how do you remember these things? I can't remember what I just did today, but I can remember what happened years ago.
I remember the class. I remember it was Ed 203, and it was the first time that I was teaching that class, and I kind of was figuring it out as I went along, to be honest. I don't know if you guys could tell, but I think that was the first time I was teaching the class, but I don't remember the first day.
Yeah.
Well, I actually had what was that, Education 1, but I had that and 203, I think, at the same time.
At the same time? Okay.
But I remember the first day I met your husband.
Yeah.
I remember that too.
Newport Beach.
Oh, when he came
conference.
to the SCTA conference. That was, I still show pictures of that to my current students because we have a similar program at West. So when I show events, I show the pictures from Newport Beach and some of the other SCTA conferences. I'm like, this is what you could do.
What was so great about going to these conferences, right, is we were the only Black people there.
Yep.
But they spoke so highly of us because even the ones that are there that's supposed to just make things happen weren't doing what we were doing. You know, like some of them would, they were all dressed fine, but me and Darren, we have to make a first impression. So, we wearing suits, ties, and doing what we do. And I remember the day when I realized that we can make something big at Southwest was when the day me and Darren we were looking for a workshop to go to. And, we were lost. We were looking on the map. We're like, we smart, but we feel dumb right now because we can't read this map, right? What we didn't know was that the room was split up into two. So it was one big room, but then it was actually two. So we're sitting there and didn't know we was talking to the vice president of the whole thing. And we just sitting there just, chopping up, having a conversation and stuff. And then that's when, he just came back and was like, I enjoy, that conversation. And that's when he was like, when I realized that he knew who we were, I said, we did something.
Oh.
But this doesn't happen without you because there's nobody else that cared about that group of people who want to be teachers like you did, which is why I walk around Southwest every day when I'm there and I pretty much cuss every step I take because I do, because it, we're not gonna get into that. We know how that goes. That's what these schools need, are teachers who care. And not just teachers who just care about football players or just care about basketball players and just want to pass them. If you cared, you would not pass it. Sports are important. Winning is important. Championships are important. Me and Tafara both play sports. We know how important winning is. But I would rather you give me an F and make me do my work and learn and understand what I'm supposed to be doing than just push me along, let me play. And then when I get to the next level, I'm looking like, what are you talking about right now? I don't know what's going on in this class, and it happens all the time. And it's not just our area, it's everywhere. We don't have the teachers that we used to have, which is one of the main reasons why I decided to, outside of the fact it was just like, Dr. Smith doing it, seems cool. All right. That's what I'm doing. But
love it.
And I think that's what made me and Darren so good at what we did when we worked at ARC, was because we knew what we didn't have and we knew what we needed. And we tried to make that happen with them.
Yeah.
You know, and because I realized at one point I said, I'm yelling too much.
Mm.
And then I realized I said, I did this same stupid stuff I'm yelling at, you know, and so that's why I was like,
That's
you know, I
funny.
kind of change up things, and you know, me and Darren pretty much kind of ran that for the most part, really. And we were actually at two different schools in the beginning because I was at a
Wow.
different school, and I'm still friends with those people that I worked with outside
That's
of
awesome.
our
You know, our
program leader because she decided to quit. But yeah, when I got over there to what was that, Phyllis Wheatley in West, I was
yes.
not sure where Henry Clay is. You know, I mean, it was just like it just all fit. You know,
Yep.
but it's crazy because taking your class and having to write out everything like, hey, um, I need you to show us what your schedules and stuff is gonna look like. I'm like, oh god.
Yep.
But then got to ARC and was
Make you
like,
learn it.
all right, we're done. And they're like, how are you done so quick? Because we were taught how to do this. You know,
that is the best gift I could ever hear.
You wanted her to just walk in here and do it like she knows what she's doing. You know, I'm like, I do know what I'm doing, and that's why it's done and it's done right. They've never turned around and given me or Darren, you know, ours back, like do it all over again or change this. No, for what? I know it's right.
That's
you
awesome.
Know?
Love
So it and you know, I said all that because I wanted you to know that your time there mattered.
Aww.
And it meant something, and it has definitely not gone forgotten. You know, because I know if I call Darren up right now, we could probably talk about 3 hours about education class.
That's a great time.
I know this. Oh, definitely. You know, and as far as I know, everybody in that class that was in those classes are doing well. I know Tia's doing well.
Yes,
she has her kids and doing what she's doing. And you know, I saw Leon about a week ago.
No, I didn't. I want to know how he's doing, and we lost touch.
Yeah, I think I had him on social media at one point, but you know, I don't now. But you know, and then
AA Ron, I'm still. Were you in my classes with AA Ron? We call him AA Ron.
AA Ron, yes. AA Ron started doing like I don't want to say production stuff, but I know he started doing like making his own like skit type things and movies and stuff like that.
Yeah.
So yeah, he's got him a girlfriend. I think they still together and everything. And you know,
so cute because I follow him on. It's so cute. Yeah. So how's Leon doing? Is he good?
Singing good. You know, I mean, but you know, people put masks on sometimes, so you know, but it's
literally now.
It's just like right. So you know, but like I said, that was because of you. That was because of your husband always being supportive of you.
Yes.
You know, and that man is black and he's gonna be pink in a minute.
That's what.
So, but it's to kind of wrap all this up. What I wanted to happen was for people to understand that all your kids want is your love. And that is, and I don't have to say this to you two or to Faro. I mean, I know he loves his kids. I know you guys love your kids. So it's not really directed towards you. It's more or less directed to people who second guess that love is important to kids.
Yeah.
And like I said before, it's only because my parents loved me that I even fought as hard as I did, to even get to this point in my life. Even though they were divorced, they still found a way to work together and do what they needed to do to raise me to be who I am. So
That is
for
great. And
all
it's your mom's
parents,
birthday, right?
it is my mom's birthday.
Hey,
It
happy birthday
is
to your mom.
my mother's birthday,
Celebrate your
and
mom.
that is the other reason why I picked this day, was because
Aw.
I would have probably be sitting there like, why am I doing this on her birthday? But
Oh,
this
Yeah.
is
so
important to
sweet.
me,
That means a lot.
because it's only a certain amount of people who's been there for me like you. So, if I'm going to, I don't always seem like I just told her I'm not coming over. I saw her this morning when she
Okay.
went when she
Yeah,
went
I'm
to
about to
work.
say.
She stopped by and I, gave her a present and everything like that, because
Oh, that's
she had to
good.
work this morning. So she stopped by at 12 o'clock in the morning on her way to work. And so I did see her. I don't, I say this publicly because I can, but it doesn't need to be said because she knows this. But I love my mother to death. She's, even like I said, even though my parents are divorced, they've been there for me together.
Yeah,
And
that's wonderful.
I
Yeah.
know a lot of people that go through things like myself, like Colson, like things that Favre been through, and Edward Drake, and and a lot of times their parents don't know how to hold themselves together. They leave, or whatever they do, and it's important for you to, it's, when you put it in order, you can say you love your kids, which is, can never be doubted, but you have to show your kids that you love them, because you can say it all day long, but if they don't know it, it means absolutely nothing,
Yeah.
because that's the person who needs to hear it the most. They need to know, okay, my mom loves me, my dad loves me,
Yeah.
whether it's real mom, real dad, foster mom, foster dad, stepmom, stepdad, whatever the case may be.
Yeah.
If you watch this now, 50 years from now, whatever, tell your kids you love them, because it matters. That's what I'm like. I know I don't have to tell you guys. I know I'll tell him as a cook, because he come like, yeah, man, my daughter's then hijacked the old school. I'm like, that's only because she knows you love her, and otherwise she wouldn't bug you like that. So your kids are lucky to have you guys as parents, same as you, Mr. Cook. I'm lucky to have my parents. I'm blessed, believe me. So
So
with
shout
all
out to Black moms. Shout out to Black moms.
shout out to Black moms. Shout out to yeah, that's, Black dads too. They definitely don't get a lot of love and respect. And that is something that needs to be said on a daily basis. I know we look at things differently. We say, Black dads ain't supposed to really show emotion. That's a lie. If you love your kid, tell your kid I love you. Give them a hug. I don't even care if you don't do this in public, really. Just do it. I don't care if you got to bring them in the broom closet and be like, I love you, and I just want to whisper, just in case anybody listening, I love you, and then go play outside or something. Get away from me. You do all that. That's fine. Just say it. And kids, tell your parents you love them, because you can look up one day and they ain't gonna be there. And that's important to, and I say that with the intent of hoping that none of y'all go anywhere anytime soon, but it's also something that you need to be ready for and understand that we are not always just going to be here.
Right.
And that's just something that we need to come to terms with sometimes. Sometimes you might mess around and look up wake up and mom, I know this experience because it happened to me twice in the past 10 years. I woke up and I remember it was a Sunday and I'm sitting there, I'm like, it's cold out here. Like cold, it's cold outside. So I went and turned on the heater. I'm standing there, I'm chilling. My dad walks in and talking about your aunt got stabbed 17 times. I'm like, what is going on here?
Oh my gosh.
What got woken up by the same man. And that was the day that my uncle passed away. And it's like it hurt because these are two people I knew for a fact. If nothing else was gonna be here at least another 15, 20 years. And I was and I wasn't even worried. So but it happens. It's inevitable. These things happen. And that is the purpose of why I'm saying right now that tell the people that you love them. Because you can scream at that casket, I love you all day long. They ain't gonna hear it at that point.
Yeah. Oh,
it matters why their feet are on the ground. So
message for sure.
So
be a
with all that said, I'm glad that your internet held up. Because I was sure going to say, you guys want to wait till next month, and then it was like popped in and stayed. I was like, cool. So, is there anything that you guys want? What'd you say?
I was just saying it was a rocky start, but yeah, go ahead. Sorry.
Hey, it's all about the finish. It's all about how you finish. So, what would you guys like for the audience that are watching, now and in the future to take from what we talked about today?
I think for me, it's thinking to the we hear the parable, the African parable. It takes a village, right? It takes a village. And you think about the structure of a family. Family structure historically was not supposed to be isolated, where we're just in a small little network in one household. When the parents or caregivers are taking care of the children by themselves, it literally was a collective, right? A tribe helping. And I feel like being the parent of children with who are medically fragile can be very, very isolating, can be very overwhelming, very lonely. And it really is a village. Like a lot of times my students will say, Dr. Smith, I don't know how you do it. And honestly, it's because I have a village. If it's not my family, my extended family, my friends, but it's because of technology, I can connect with other parents and families. A lot of the programs that Colson has been a part of are such that the parent network and the parent support is really strong. I belong to different support groups specifically for parents of children with special needs. So I would just say, surround yourself with your tribe, surround yourself with your village. Don't be afraid to share your story. That's why I really appreciate this platform. Don't be afraid to share your story so that you can find out about resources and find out about support, just to let yourself know that you're not alone, because your child needs you to be strong, right? If you're breaking down or depressed or what have you, then you're not going to be the best that you can be for your child. So my best advice is just to, position yourself in such a way that you have a village and that you call on people for help, and that you look for resources that are going to help give you that support, because it's there. You're not alone.
I'm not even gonna follow that. I'm just Mr. Cook, you got anything you want to end with?
I just want to say, thank you for sharing your story. I'm gonna pray for Coco and pray for you guys also. Like I said, all you guys, whole family, the Smiths are warriors for sure. And
so are you. You inspire us.
Thank you. But I just appreciate you guys share your story, and also the insight with Philip going to school. You guys' relationship. That was wonderful just listening to it. So thank you.
Yeah, it was awesome. Thank you so much for having us.
Oh, it was a pleasure. Thank you for joining us. We appreciate it. So we will B-Bay was that Thursday, Mr. Cook, the 18th. Kelsey Reed, the nutritionist, will be on to present to you guys on how to shop with CKD, which is chronic kidney disease. And then the 21st, we'll be back here. And the 22nd, Mr. Cook will be telling his story here on the Second Chance of his fight with kidney disease, transplant, dialysis, the whole thing. As well, I on my birthday on the 23rd. The 24th, we'll have a donor tribute panel that will be right here on the Second Chance on that Wednesday. So, please have a wonderful Sunday night. Hug your kids, hug your parents, hug your family. If you got to text them if they're in college or something, let them know you love them. It's important. It's imperative that you do this, and don't be afraid to do it. If you're afraid to do it in public, that's fine. Just do it. So again, thank you all for watching now and the future. We appreciate you, your love and support, and we will see you guys next week, and we are actually going to end with Mrs. Cook.
Hi everyone, I'm Camille Cook, the family nurse practitioner, the creator, the developer, the chef, and the cook of crack. Well, Creamy Crack, the addictive, all-natural body cream. I have a background in dermatology and cosmetic surgery. And I created a 98% organic and a 2% all-natural body cream in 2011 for both my son and husband. My son, who suffered from the irritating symptoms of eczema, and my husband, who was a 2-time kidney transplant survivor and who was on kidney dialysis for over 10 years. They both suffered from the dry, itchy, scaly, and flaky skin. And as a mom and a wife, and with a background in dermatology as a nurse practitioner, I couldn't stand back and see them suffer any longer. So I got into the kitchen and started cooking crack. Well, Creamy Crack again, the all-natural body cream. It moisturizes, it replenishes, it restores, it heals and protects your largest organ. You got it, your skin. I have been able to make such a difference in the lives of those people who suffer from the irritating symptoms of being on kidney dialysis or who are awaiting a kidney transplant, and also for those who suffer from eczema. Those people or individuals have suffered way too long and tried too many things to help their skin come back to life. I am so honored and grateful for you to try this all-natural body cream. Again, that's going to help you look and feel better with your skin. Creamy Crack can be found on all social media platforms at Creamy Crack Body Cream, or can be purchased at creamycrackbodycream.com. I look forward to serving you, sharing with you, and making an impact in your life. I hope you'll go out and try Creamy Crack, the addictive, all-natural body cream. Thank you.